Hello, I'm Dr. Dennis McKenna. As always, I'm joined by, there's no mustache. It's not Dr. Venditti. This is John DePaula. He is our Executive Associate Dean and Chief Administrative Officer for the college. John, welcome.
Thanks for having me, Dr.
We've had you here before,
Yes,
and
sir.
it's great to have you back.
Good to be back.
All right, today's Thursday, April 29th, giving you the update from Albany Med. All right, so John, as always, we'll begin with some COVID numbers.
Great.
We'll pop open the first graph there. You can see in the 8 counties of the capital region, we currently have 96 people in hospital beds currently with COVID. That's about 10 less than a week ago. And as Fred and I have been talking, it's hovering, although honestly in the last couple weeks it's come down slightly. So that's good news.
Great progress, Dennis. Great to hear.
Here's the graph from the medical center this morning, our AM census. We're currently sitting at 21. The breakdown there is 15 on the floor, 6 in the ICU, 3 on ventilators, and of those 21, all of them are currently adults, so no children in the hospital at this time, which is good. We're getting about maybe 1 to 2 admissions per day.
Yeah. Another positive trend, Dennis.
Absolutely. Now, speaking of a positive trend, I know, John, you and I both want to talk about this. We hit an incredible milestone yesterday, and we want to celebrate that, and we want to thank everybody involved. As you know, the region, the capital region, is composed of the 8 counties. Let's name them again. We have Warren and Washington, Saratoga, Schenectady, Rensselaer, Albany, Columbia, and Greene. There's slightly more than 1 million people there. And that's the region we talk about when we talk about our COVID numbers. That's also the region we talk about when we talk about our capital region vaccine network. Yesterday, we crossed over 50% of the eligible people in the capital region have received at least 1 dose of vaccine. And that's remarkable in its own right. But what's even more incredible is, and we should be very proud, of the 10 hubs in the state, we have the highest percentage of people who have received a first dose, and we have the highest percentage who are fully vaccinated.
So first in New York State.
Yeah.
Great
Now, John,
stuff.
John, you were with us day one, setting up the clinic down at 1275 along with a lot of other people. So that, I think, set the momentum to where we got today as a region.
Yeah, no doubt. I mean, it's been a really incredibly collaborative effort across the region. Lots of different hospitals, providers, all participating, county obviously, to get people vaccinated. So tremendous success story for our region, no doubt.
No doubt. Let's give the numbers. So as of today, now we have 547,000 people who have received at least 1 dose. That's 50.4%. And we have 410,000 that have completed, 37.7%. Important message really is, as of today, even if you don't have an appointment, you can go to any of the mass vaccination sites and just walk in. So eligibility now is anybody 16 and above. There's plentiful vaccine. There's easy ways to get scheduled. Go to capitalregionvax.org. You can schedule an appointment. You can walk into these larger sites. We have a lot of work to do. We want to get to 75, 80%, but we've made great progress. So congratulations. Thank you to the Regional Advisory Task Force. Thank you to the Health Equity Task Force. Thank you to everybody in the region that made that happen.
And really, Dennis, thank you for leading the region in your role as leader of our hub. Absolutely outstanding.
Thank you, John. Thank you. Before we move off of COVID as a topic, visitor restrictions are still in place in all statewide hospitals, but there has been a recent change made. You can now have 2 visitors come in. We've been doing that now for the last couple weeks. It's an important reminder here to all of you. The visiting hours are still 10 a.m. to noon and 6 to 8. But you can have 2 people come in, and we've seen the number of visitors increase
steadily,
which is wonderful because it means that we're having more people at the bedside with their loved ones. And we thank security and everybody who makes that happen. I know, again, John, you've been involved in those efforts with logistics and incident command.
Absolutely. We're trying to do it safely, so we're temperature checking everybody that comes into the hospital, all visitors, to make sure nobody's running a fever. We're making sure everybody's masked, and now we're upwards of over 600 visitors, which is a significant volume on a daily basis. And it's great for our patients to see their family members.
It sure is. Let's change gears. Let's talk about employment. Let's talk about the medical center. Recently voted the Capital Region's best hospital. It was a reader's poll. The medical center is open for business. We're returning to some of our volume. And we want to hire people, and we've been hiring people, and we've had a couple of very successful efforts lately in a couple different areas with some job fairs. Why don't you talk a little bit about that, John?
Sure thing, Dennis. So, given our circumstances of wanting to hire more people, we've done job fairs specific to some of our work areas. So, just this morning, Steve Corey called out how we've done a job fair for our emergency department, had some success in hiring some emergency department nurses, as well as some emergency department advanced professional providers. In addition to that, our physician practice has also held a job fair day. And again, we've gotten some clinical staff to begin working here at the medical center, as well as some administrative support staff, which we're in need of as well. And then I'd also like to call out in support services, we have Aramark that helps provide a career center, staffing center in addition to developing careers. And they've also done some very unique things in reaching out to the community and trying to get staff here for the medical center. So lots of success, lots of effort on a lot of different fronts in recruiting people to the medical center.
Yeah, these job fairs are wonderful because when qualified candidates present and there's been an interview process, offers are made right on the spot. And this is great because people are anxious to get to work. We're anxious to put them to work, and so it's a great opportunity. I'm familiar with the ED one, of course, being my clinical area. I know that Patty Mayo and Scott Weiss were very involved along with HR making that happen. So it's a great model, and we want to do more of that in the future. And if you're in the region and you want to work at Albany Medical Center, please reach out to us. John, on the intranet today, there was some discussion about something called the Pediatric Aerodigestive Clinic. And that may sound a little bit confusing, but let me break it down. This is the type of thing that only Albany Medical Center can do. In that we bring together into one location in a clinic for children specialists that includes pediatric otolaryngology, that's ear, nose, and throat, gastroenterology, pulmonary, surgery, speech and language pathologists. So when you have children who have complex medical conditions that deal with swallowing or breathing mechanics, you sometimes need multiple specialists to see them. We bring them all together in a clinic where that evaluation can be done comprehensively, easier for the patients, easier for the family. So we want to thank everybody involved in that. We do things like that that I think are unique in the region.
Yeah, and again, Dennis, one of the unique aspects of being an academic medical center, of having all of these various subspecialty physician experts, and now being able to pull them together collaboratively to offer this type of care that you can only do at Albany Medical Center, really, really special.
So in that same vein, next week is the Bernard and Millie Duker Children's Hospital annual radiothon here at Albany Med. I believe it's next Thursday. It's on the intranet. It's an annual event. It's lots of fun. Phone banks. People will be calling in, making donations. We'll hear some personal testimonials and stories from people who've been impacted by the care delivered on this campus. Two local radio stations involved in that as well.
Yeah, WGY and 99.5 The River.
So we look forward to that. We thank those radio stations for their involvement in our radiothon. We thank our workforce who will be volunteering, and we look forward to seeing those families on campus.
Great stuff.
My little friend Olivia is going to be there. I'm looking forward to seeing her again. Finally, John, at the most recent Center Combined Leadership Meeting, we recognized two of our recent winners of the iCare Award. Let's remind ourselves, CARE stands for compassion, accountability, respect, and engagement. And so we pick people from our workforce who embody those incredible traits. I'll go first, you can go second. Kathy Bush, an LPN from our pediatric ICU, 45 years. John, you were there. The accolades that people wrote about the things she does to improve the work environment. She's a source of incredible institutional knowledge, a great teacher, very deserving of the award. It was wonderful to give her that. And we had a second one as well.
And Bill Crone, who's longtime associate professor in our PA program at Albany Medical College. Bill's been an associate professor for many years. He serves in a leadership role at the PA program. And Bill has been on our faculty senate, has helped us on a lot of other leadership fronts. And the call-outs that he got during that
they were great.
Were excellent, and really goes out of his way to serve the students and help the students in any way he can. So Bill is just tremendous.
All right, I agree. So congratulations to Dr. Crone, congratulations to Kathy Bush, two incredible recipients, and it's wonderful to recognize them here. So we're heading into the weekend. Every Thursday, we always thank our workforce who will be working around the clock 24/7 here this weekend. And we'll be back again next week. John, thanks for sitting in.
Thanks for having me
appreciate you being
again,
here.
Dennis.
You know we'll have you back. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.